Welcome back to another amazing video with Rohit and myself, Laura from Front Office Rocks and Rohit from Practice by Numbers. And we are diving into revenue IQ within Practice by Numbers. So if you haven't seen a video before, please go back and watch the overview of this section of Practice by Numbers. But as an office manager myself, this is one of my favorite things about Practice by Numbers, is not only is my office up to speed on our case acceptance, and if we've pre-appointed our patients and our collections and our production, but we also now have a list of patients that we can pull from to get my team on the phones, to get our patients back in, to fill our schedule, all the things we want in our dental office. So I'm going to turn this over to Rohit. He's going to show us in Practice by Numbers this revenue IQ that's going to help your team pull out real treatment that needs to be done to help them get on the phones and get the patients in. So can you show us a little bit about this?
Yes, absolutely, Laura. And thank you so much again for another great video. This partnership between Practice by Numbers and Front Office Rocks. And as we showed in the previous video about revenue IQ, there are different categories. And today we're going to focus, in this video, we're going to focus completely on following up on treatment. And it's incredible how many times we bring on a new practice and we ask them, what is your treatment follow-up? And they look at me funny. What do you mean? We give them treatment plans and then they leave. And then they call back sometimes to schedule. And it does work to a certain extent. You get 50, 60, 70, maybe up to 70, but I doubt it. But 50, 60% of the patients, because they're 2/3, they call back and schedule that root canal that they needed. But in case you have elective treatment and other things that can be procrastinated, delayed, patients don't call back. You have to call them back. You have to also show that there's interest in you to maintaining their oral health so that they will, that it's important for them to get that treatment done before it gets any worse. So how does it work? Treatment, once you click on Revenue IQ, and everybody who has Practice IQ, this should be available for them. You click on treatment type, and there are different macros here, and let me just tell you what these different macros are. We're going to focus on only one today. SRP, but not in peri-maintenance. What this does is it finds you all the patients that have completed their scaling root planing, but they don't have a peri-maintenance schedule. That's an important one, and you do see those patients every 3 to 4 months. So it's additional revenue for a hygiene department. Another category is emergency exams, but no comprehensive exam. Why is this important? Because you pay so much money per patient to bring them in, and if all that you do is an emergency exam and then they leave and they never come back and become a permanent patient of the practice, it's probably because they were never invited back. So here's a list to find those patients, to bring them back and say, hey, you got an emergency exam, let's bring you back in for a comprehensive exam. And the other ones, incomplete crowns, incomplete restorative fillings and cavity, all the direct restorations, incomplete perio, SRPs that were diagnosed. These are all self-explanatory. You can run the queries very simply. Let's today focus on all treatment. Now,
and actually, let me jump in real quick, just as an idea for anyone who's watching these. For the incomplete perio and the SRPs with no perio maintenance, I actually like that these are separated out the way they are, because when my hygienists have holes in their schedule and I want my hygienist to help the schedule and be productive, they log in and they're calling on these perio patients. So it's not always about your front office team who can help out. It's not always about your schedulers. Sometimes you can grab your assistants and your hygienists. So I have my hygienists, they're working on this project where they're actively calling these lists to get the patients back in, because they're the ones who met with them and know how important it is to get the patient in to keep them healthy. So just a side note or an idea for anyone watching this.
Yep. So let's look into all treatment. Now, what are we trying to find here? What we're trying to find is any patient that had a treatment plan, any item treatment plan for them, but they did not schedule it. Okay? One of the caveats that you have to know is this is all treatment that's in their treatment plan that's not been scheduled. So if you have lots of let's say you make multiple treatment plans for, somebody's missing a tooth, you do a bridge or a flipper or an implant, and all three of them exist, our system will show all three of them. So you have to make sure you go back in and then you reject the ones that were not viable. Okay.
And I'm going to mention in this is all, application of how we do it in the dental office. This has helped us clean up alternate treatment plans as we're going through this list, because if you actually pull, we work with EagleSoft in my office, if you pull the outstanding treatment plan report, it's so long and it's so overwhelming, you can never get through the whole report. So this helps us as we're making phone calls and reaching out to patients. If we recognize it's an alternate treatment plan, they ended up doing the bridge and not the implant, we can then reject it like you're saying and keep it clean. So this helps us keep our practice management software clean.
Right, right. So let's do this. Every office should have a methodology of following up on treatment. And I'm sure Laura has her own, but when people come to us at Practice by Numbers, I suggest when the patient walks out the door, if they walk out without scheduling their next treatment, you need to be following up with them. You need to follow up with them 2 days after they walk out, 2 weeks after, and then 2 months after. Okay? And make it a consistent way of following up. And here's how you're going to do it. Click on All Treatment, and this will select all of the treatments that you're trying to find. And there's a lot of ones that we have unselected already, and the reason we have done that is these are all diagnostic codes. And normally people don't enter diagnostic codes in treatment plans, but even if they did, we are trying to take all of them out so that we're not calling patients if they were treatment plan for a trophy, for example. Okay? So all of those things are taken out, the diagnostic ones and also all the preventative ones. And I'm going to change the time period. Let me move this down. Let me change the time period to say I'm going to look at all of the treatment that was diagnosed in the last 1 week. Okay. There we go. I'm gonna hit search. Change this time to no limit. Now here is a list. Last 1 week, there were 11 patients that were diagnosed treatment that walked out without any future appointment. Okay. Or any appointment for this treatment. Okay. What each office needs to be doing is pick up the phone call, click on this item, and the patient's name and their phone number and everything is listed right here. And we also list any of their future appointments. And we also show you the complete account details for that patient, just in case you're going to do a quick research before you're calling them. Once you call the patient, should mark what happened when you call this patient. Did the patient schedule? If the patient did not schedule, what was the reason why they did not schedule? Let's say it was they can't afford it right now, and then you make a note. Whatever note you make here will start appearing in the contact log. And the contact log will be there forever so that next time you come in here, you know exactly what's going on.
So for me, what I do in our office is exactly what you've said up to this point. I then have my team copy and paste that note into their notes in EagleSoft or whatever practice management software you have, so that it's still in EagleSoft, but it sits in here to make sure that we have it in both places. But I do exactly what you're saying. And what it does is now it will take this person and remove them from the list so that we have a dynamic list going of patients we need to call, not a stagnant piece of paper that, we're crossing names off the list.
Right. Now, when you do this, the last contacted will get updated and the outcome will get updated. And the next time you run this list, this person will not show up for as long as you have said this last contact. Right now, I said there's no limit. So you do that on a weekly basis. You call the patients from the previous week. Okay? And then you also call the patients from the previous month. So let's go back here. I'm going to select all the patients that were presented treatment in the month of February.
And I'm going to a little caveat there, because like you said, everybody has their own protocol. So, and we're not saying it has to be 1 week, 1 month, 1 day or 2 days, but you do need to have some sort of a process in your practice, because the biggest issue is when you have a patient in the office and you tell them that they really need to get this crown because they have a crack in their tooth might break, they don't want to lose the tooth, and then they leave and then they don't hear from you guys for months and months and months. They're thinking, did I really need it? Are they just after the money, or were they just after the insurance? So it's our job to, even if the patient doesn't schedule when they're there, to make sure that they know it's important and that we're following up with them regularly to do our best to get them scheduled, to get them in and get them taken care of, not just the one time that they're there. Because if they leave and we don't follow up, they're going to wonder if it was necessary anyway.
Right, right. And it looks like, Laura, you're already doing that in your office. I already see there are calls being made, and this particular patient was called on the 8th of February, and he left a message.
So yay, Scripps Rock Dental, right? So on that note, we want to make these videos nice and short and comprehensive in a certain area so that you can show this to your team and that you can start implementing this into your practice. So the number one thing I would suggest is learning about Revenue IQ, sitting down with your front office, whoever makes phone calls, teach them how to pull from this list, make a protocol of how you want to implement it in your practice, but then mostly get on the phones. A lot of times we have these ideas of things we want to do and we never implement it. The best thing about Practice by Numbers is the day that we logged in for the first time, my team was on the phones using the list. It's that easy to do. So take the time to learn this area. That's why we're breaking it down in such small segments so that you can give this to your team as a way to get them on the phones and help them reach your patients that aren't scheduled.
Right, exactly. Find a process that works for you and start to follow it and track it. And one last thing is, make sure you monitor it to see how many calls were made. So if I look into last month, how many calls were made? 117 calls made. That's great. Now, hopefully this month is going to be 217, and next month is going to be 400, and you just keep building upon that and then tracking the performance of your employees.
Exactly. And if your team knows that they can be tracked, they're going to be more active or more excited about being able to make the calls, and especially when they can convert these patients to actually scheduling. So we're hoping that this part of Practice by Numbers can show you how you can get more treatment into your schedule. And if you need protocol suggestions, reach out to myself at Front Office Rocks or to Rohit. We can give you suggestions and ideas of how to implement this easily in your practice. So thank you again for watching one of our videos of this amazing software.
Okay, thanks a lot, Laura.
Thank you.